name is Kristen, and I'm going to be your student nurse today. I'm going to prepare your feeding through your NG tube. First, what I'm going to do is listen to your belly. Okay, I hear your bowel sounds. Do you have pain or tenderness whenever I push on your belly anywhere? No? Okay, that's good. So what I'm going to do, I'm going to put my gloves on. I'm going to take your tube and I'm going to push a little bit of air into your belly. Unclamp the tube. Pop, pull back, check for secretions, and I see the gastric secretions. So I'm going to clamp the tube again. Take the plunger out of the syringe. Connect the syringe back on to the tube. I'm going to pour the predetermined amount of feeding into the tube, unclamp it, and let the feeding flow through the tube however much the order is written. And before that feeding, before the tube is emptied, I'm going to put 30 mils of water in to flush out the tube and hold that up to make sure that all the water in the tube gets drained out. So I'm going to clamp the tube back, disconnect the syringe, cap off the end of the tube, and then I'm going to clamp this back onto the patient's gown. I'm going to assess my patient, make sure that they're doing okay. Do you have any abdominal pain? Are you feeling okay after that? And then I'm going to return in 4 to 6 hours to check the residual amount. And if that is okay with the orders are written, I will do the next feeding. Yep.
Hi, Mr. Sicky. My name is Teresa. I'm going to be your nursing student for today. I'm just going to make sure I have the right patient, right? And I'm going to prepare your feeding, so just sit tight for a second. I'm going to put on my gloves. I'm going to clamp the tubing on my feeding bag. I'm going to get my formula for feeding, and I'm going to pour the predetermined amount in the feeding bag. In this case, it's 240 milliliters. Okay, and then I'm going to label my bag with name, date, and time that the feeding is going to be infused. I'm going to unclamp my tubing and prime the tube, and then clamp that back off after it's primed. Then I'm going to go over to my patient and assess my patient. Alright, Mr. Sicky, I'm just going to take a listen to your bowel sounds. Palpate your abdomen. Do you feel any pain or tenderness whenever I push on your belly like that? No? Okay. Alright, the next thing that I'm going to do is check for proper placement. I'm just going to put 10 cc's of air, and what I'm listening for is a pop. Okay, so get the pop. And next I'm going to aspirate the gastric contents. And I'm going to note that, document it, and then push that back in. Disconnect my syringe, and then I'm going to connect him to the prepared tube feeding. Okay, I'm going to unclamp that and start my tube feeding. It's 240 milliliters over 4 hours. I'm going to set the pump to 60 milliliters per hour and hit start. I'm going to ensure that my patient is maintained in an upright position throughout the feeding. And then if they need to lie flat during the feeding, I'm going to pause my pump, allow them to lie flat, and then before I start feeding again, I'm going to bring them back to the upright position.
Okay, hi baby Sicky.
I'm gonna look at your armband, make sure I have the right baby. Okay, I'm just gonna check the Mickey button site, make sure there's no redness or swelling around it. I'm gonna put my gloves on. And I've already prepared and primed your feeding, and it's ready to go whenever you are. So I'm just gonna unplug your Mickey button. And I'm gonna get my extension set and line that up just like that. And then I'm gonna turn clockwise about 3/4 of a turn until I meet resistance. Okay. And next I'm gonna check for patency. So I'm gonna take my syringe with 10 cc's of water. I'm gonna connect it to the extension set and unclamp my tube. And I'm gonna aspirate the gastric contents. Okay, and then I'm gonna return the gastric contents with the 10 cc's of water, and I'm checking the site for any leakage, which will ensure the patency. I'm gonna clamp my tube, remove my syringe. I'm gonna get my prepared tube feeding, connect it to the extension set, and unclamp my tubing, and then I'm gonna set my pump at the predetermined rate set by ordered by the doctor.